Do black people who perm and relax their hair have a disorder? According to the DSM-V, a mental disorder is a syndrome characterized by clinically significant disturbance in an individual's cognition, emotion regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental processes underlying mental functioning. Mental disorders are usually associated with significant distress in social, occupational, or other important activities. An expectable or culturally approved response to a common stressor or loss, such as the death of a loved one, is not a mental disorder. Socially deviant behavior, example, political, religious, or sexual, and conflicts that are primarily between the individual and society are not mental disorders unless the deviance or conflict results from a dysfunction in the individual, as described above. If I needed to revise the above definition to make the first part clearer, I would write: a mental/psychological disorder is a syndrome, a group of symptoms that consistently occur together, or a condition characterized by a set of associated symptoms that can be observed in a person's actions, their relayed thoughts and feelings to a listener, whose common elements deviate from a social norm. Social disorders are described as a marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny to others. Thus, the social situations are avoided, the avoidance lasts more than 6 months, and the fear or anxiety causes distress and impairment in social, occupational, or other areas of functioning. Have you ever heard a black person complain they couldn't leave the house because their hair wasn't done? How about the excessive hat use in the black community? And of course, the prevalence of black women relaxing their hair or donning the hair of other races on their head. Should this be labeled a specific social anxiety disorder? The fear or anxiety of wearing African textured hair in public.